watch this video and go, oh, how cute and how nice. I watched the video and I'm filled with rage.
All right. Well, next up, we've got to talk about the YouTube drama that's blown up the internet over the last few days. And for folks who aren't as online as me, well, let's be frank, they might not have heard the name MrBeast. But I will tell you, if you have children who are on YouTube, which almost all kids are, they know MrBeast. He is the biggest YouTuber of all time. He's just got crazy views, and he's made a multi-million-dollar company out of it, and they've started doing just basically like charity and then making clickbait out of it, which is pretty amazing. So this week, he released a video where he boasts that they cured 1,000 people's blindness. And then the video thumbnail is somebody seeing for the first time again. And it was a pretty remarkable video. I watched it. It made me smile. What they did is they paid for 1,000 people who didn't have insurance to get cataract surgery for their eyes so they could see again. So they'd lost their vision, or their vision had become very cloudy over the years because of cataract issues, and they didn't have health insurance, so they couldn't get this covered. And he came in and his team, and they paid for 1,000 people. And then all they needed in exchange was interviews and allow it to be taped to show their before and after. And it's this heartwarming video. I don't know, but I loved it. It has over 50 million views. For me, Hannah, it was so nice to see the internet, something blowing up that wasn't negative and toxic, but was actually like love and charity and goodness. How did you feel about it?
I mean, how dare they? No, I'm kidding. That actually is how a lot of people reacted, and it blows my mind. I thought the same thing as you. It was great. I love to see charity. I think, if you look at the data, the U.S. is actually one of the most charitable countries in the world, despite having pretty high taxes. We continuously are very giving people, and I think that capitalism enables that. When you have a lot of wealth, you can give back more, so it's cool to see somebody in his position using not only his money to do something good, but then his platform to sort of advocate for that kind of action. So that should have been the end of the discussion. Like, how beautiful.
But it wasn't.
Wonderful. This is excellent. But no, it was not. In fact, you have some comments here that people left in reaction to this in the document that are just mind-boggling to me. The first one says, there is something so demonic about this, and I can't even articulate what it is.
Demonic.
What? Demonic?
Charity. Healing the blind. Demonic.
Demonic, yeah. I think that's what Jesus did, actually, not the demons. Like, you got this in reverse, honey. Super weird. Another person said, I hate money because it makes people seem good when all they're doing is spending a little cash to do something. I bet most people will watch or see this and say he's a good person because the amount of money is so high and so charitable, but money isn't charity. It isn't at all.
What?
How? Like, I don't know. These people's brains are broken, honest to God. Like, how do you function in the world when you're at this IQ level? Like, something's off. These are the dumb drivers I'm yelling at.
Yeah.
This is them.
Well, and what he mentioned there is that's the root of the backlash that the fact that this prompted backlash is nuts. But this did prompt backlash, including from the leftist socialist streamer Hasan Piker, who I will admit I actually enjoy. He's a nut job ideologically, but his content is very entertaining. But he said that while most people were happy about this video, it actually made him furious. Take a listen to why.
You watch this video and go, oh, how cute and how nice. I watched the video and I'm filled with rage.
What's wrong with you?
That we shut off access to a 10-minute procedure because we paywalled it and decided that like some people just simply can't get it. It is so insanely frustrating that it's up to like one YouTube guy to like decide to make content out of it that people who are too poor can't just fucking see. That's insane. Anyway, sorry. It's just like a deeply, deeply frustrating concept.
You pay for my surgery?
Yes.
So I get what he's saying. He's not hating on MrBeast for doing it exactly. He's hating on the fact that we have this system where people have to pay for healthcare, and it's not all just free, aka pay for all of us and much higher taxes. But I think it's stupid, partisan point, and I think he misses a lot with this take.
Yeah, I think there is a lot to unpack there, but the reasons that healthcare services aren't free is it requires other people doing extensive amounts of work paying extensive amounts of money in order to get qualified to provide you with that service, and they need to be paid. And I know what these people get at is that, well, the government should just come in and pay for all of this. And to have that stance ignores the very bottom line of why healthcare is expensive in the first place. Hint, it's the government. And secondarily, it ignores pretty much all of history and the operational issues that we're seeing in other countries like England right now that have socialized medicine that they want to bring here, and what that means for wait times, what that means for ability to actually access basic services. It's why you have such an industry of people leaving those countries and coming here to get procedures.
I'm sure you could get on a wait list for this surgery in one of those countries.
It's free, but you might die before you get it. Like, it's just so ignorant, and it really isn't hard to know these things. It amazes me, people of the internet right there at the tip of their fingers, and yet they remain totally ignorant about very basic operational practices and issues in these other systems. It's not hard to find this information out if you're actually looking for it, but I think a lot of these people, they're not serious policymakers, right? And this is why these people are YouTubers and like haven't ever actually probably worked on policy, because it is nuanced, it is difficult to unpack, and there is a lot, there are a lot of things going on that you have to consider when you dig into this. And again, if you're not somebody who's looking for the root cause of problems, you're going to be really bad at setting policies to address them, because you're going to go for easy, knee-jerk sort of emotional reactions. And those are usually not the right ways of actually achieving your end goals. The end goal here should be, why is healthcare so expensive in this country that many people cannot afford it without insurance? Why do people still not have insurance when allegedly that's what we're paying for under Obamacare now? There's several things to think about here, and we can get into that, but I think that's my initial gut reaction when I hear this kind of take.
Well, yeah, the point you just made is so key. We already have, quote unquote, free healthcare for tons of people in this country between Medicaid and Medicare, both of which cover cataract surgery when it is medically necessary, such as these cases that were in this video. These people are uninsured, which we were told isn't going to happen because we have Obamacare. We have all these programs, yet somehow they still can't. So either they're not poor, and so they don't qualify for Medicaid, or they can't participate in the Obamacare exchanges because they're so expensive and broken and dysfunctional, even though we were told that would fix it, that they don't have health insurance and that covers this, and they couldn't get this surgery until somebody came in and helped them out, which guess what? Hasan Piker's also a multimillionaire. He could do something like this, and I haven't seen him. I would love to see him do that, but he would rather talk about how the government should come in and make it free. And look, it could, but that's not really the root of cause of the problem here, which is people not being able to afford healthcare. And that's expensive for so many reasons, but it's not because we have a free market. In fact, we spend more on government spending on healthcare than a lot of these countries that have much like socialist systems, because it's that broken and dysfunctional. And we have, I think, almost half the country already on government healthcare of one sort or another. And yet still, all this spending, all these government programs, and we still have people falling through the cracks. I don't know how that is compatible with, well, we just need to do it harder. Because we do actually have free market alternatives here. Most of healthcare is based in price controls and highly regulated and subsidized, and it's enmeshed. The markets are completely controlled by insurance companies. It's nothing approximating a free market. However, one thing, LASIK eye surgery, which is something similar, but it's not like medically necessary, so it wouldn't be covered by your insurance, but it helps your vision. You no longer need reading glasses, whatever. A lot of people have gotten it. Well, it's basically a free market because it's not covered by insurance, so people just pay out of pocket for it. And at first, it cost tens of thousands and thousands of dollars, but the price actually decreased by like 75%. And now it's become super affordable. And now people are getting it more and more and more in this competitive market. There's multiple providers, and it's like actually functioning, and people can get it for low affordable prices. They can get it when they need it. And so many people have been helped by it. And, you know, I bet we could have something different that would also apply to cataracts in an alternative system where these people were allowed to keep their money, right? We could cut their taxes. I'm sure all of them who work are on heavy payroll taxes. They're given over to the government for benefits they're never going to see in pie-in-the-sky Social Security nonsense and all that. We could let them keep that, have a free market for this surgery, and I bet you a lot of them would have been able to afford it themselves. And when they can't, charity could step in. And that's a wonderful thing that free marketeers support. We just don't want your socialist healthcare nonsense with the people who prove their incompetence time and time again, making life and death decisions over our healthcare and then starting rationing and all these disturbing things and double U.S. taxes, right? Like to pay for this, all this. I mean, I think it's a terrible policy idea. I also just wish we could have nice things. I wish we could have one nice moment of like the internet saying like, oh, what an amazing thing happened, without them trying to push an ideological agenda off of it.
Yeah, but I mean, you stumbled on to what I think people need to get wise to, which is that the health insurance companies are how the government basically took control of the healthcare industry decades ago. You do not have free market capitalism in the vast majority of this field. These insurance companies, the medical associations, the hospital associations, they all work to limit the basic supply of providers. They work to limit how many people can become doctors. They work to limit how many facilities can open in an area. They work to limit all kinds of things in that manner, which is through government regulations, so that you have fewer providers, fewer services. That means as demand increases with population growth, prices go up. You also have a regulatory structure that's put in place, mostly via the insurance companies. That means providers have to jump through all kinds of expensive loopholes. They have to pay people to make sure they're in compliance. They have to spend a lot more of their time on paperwork and government bureaucracy versus seeing more patients, so they don't make as much money as they're going about their day-to-day. We've seen in many models that cut the insurance companies out, prices fall. You mentioned LASIK. That's a great example. Plastic surgery is another wonderful example where you don't have insurance, and so those prices have continued to come down. I don't know the exact rate, but they are much, much cheaper now than they were even when I was born.
Hallelujah.
Yeah, hallelujah for me. Also, you have things like direct primary care, which is a model I've passed legislation on, that basically allows general practitioners to cut the insurance companies out, get back to direct patient-consumer relations with the doctor. You pay cash for most services. Not only is that much cheaper for the patient, but the doctors in Tennessee, where we passed this, they were able to see so many more patients and make more money per patient because of that, that it actually increased their ability to give charity care. They were able to give one charity visit for every 6 clients that they saw under these models. So that's absolutely the direction we should be going. Right now, trying to push more and more people onto government care, that's why healthcare is getting more expensive. Medicare and Medicaid are practically insolvent. All of us in the actual spaces outside of these programs have to subsidize that, because when providers don't get reimbursed the rates they should by these government programs, they pass those costs on to us and people who are having to actually pay for care in the private side of things. Same thing with the insurance model, right? We are paying to subsidize poor people to get insurance. That's making insurance prices go up for everybody. Meanwhile, the actual price of care continues to skyrocket, and it will continue to do that until we go the opposite direction of what people like this are advocating for, which is more government involvement in the market. We need to get it totally out, and I think you would see prices come down, and a lot more poor people would actually be able to afford basic care because the prices would get back to real supply and demand. That can't happen as long as you have the government acting as this like crony middleman. So I think they're completely misguided, very ignorant of the healthcare system in general, and people who don't understand the root cause of problems should not be trying to suggest policy solutions ever.